I'm Dr. Dan Stock of Pure Health Functional Family Medicine, and we're here to discuss the hidden disincentives for cost-effective healthcare. It depends a lot on the amount of time that's spent there. I can tell you that the last I checked, if you were to spend a 30-minute appointment with your doctor, should you be able to get a 30-minute appointment with your doctor, that would generate a bill in the neighborhood of around $150, which would probably be discounted down to about $98. Is what the doctor would actually receive for that, assuming he had done all of the protocols that he was told he had to do to get his $98. And then from that, the doctor would have to subtract all of the expenses that he has to spend to get the money from the insurance company. So at the end of the day, the doctor probably walks around with out of that with probably $30 to $40 out of that $98 that he gets for the half-hour visit with you. This is one of the many hidden disincentives that doctors who take insurance are forced to deal with. First of all, I think everyone should know that insurance companies and the governments pay doctors better if they will see 10 people for 6 minutes than if they see one patient for an hour. And it's not a small difference in the amount of money that's paid to that physician if he's willing to see people very rapidly for short periods of time, which means that in-depth analysis of complicated decisions, or looking not only for a option, but the best option, is something that's frequently sacrificed. In addition, for almost all chronic diseases and many acute diseases, governments and insurance companies have come up with protocols. These protocols are what they consider to be optimal medicine. They are almost always one size fits all and usually chosen because they are easily and accurately budgeted. And if a doctor is not treating people according to these protocols, then the amount he will be reimbursed from the insurance company and the government is actually reduced. So what he gets for his 6-minute visit with his patient is actually determined by what advice he gives the person during that 6-minute consultation. Which of course makes the doctor, even if he's not twirling his mustache and thinking about how to steal from the patient, which I would tell you most of my doctor colleagues are not, he's still in the back of his mind is distracted by the idea that his family will be financially impacted if he gives this advice versus that advice. In addition, when doctors work for hospitals or health networks, the health network is actually paid based upon this same formula. And they actually give incentives to doctors to make sure that they practice according to these protocols. Many of them actually have either written or unwritten criteria that a doctor must actually generate so many referrals, so many MRIs, so many laboratory tests, as these are the things that make money for the hospital. An important thing to know about the relationship between insurance and the Medicare and Medicaid programs is that hospitals lose money on every Medicare and Medicaid patient that walks into their office. To keep that system afloat, it has led to an overcharging and high-priced care of those who have insurance. So if the amount coming from the insured population actually drops, then the hospital starts to go into the red, and rather than go bankrupt, it will simply pay doctors with quotas of things they must order so that they get enough money from the insured population to cover the losses on Medicare and Medicaid. It's very difficult to actually get to the root causes of any chronic disease because it's not usually one cause, it's not usually two causes, it's usually multiple pieces put together. In addition, much of the testing that is necessary to get to the root cause isn't in the budget from the insurance company and the government, and therefore considered out of network and frowned upon for the physician to order. And that's always in the back of their mind. Are they hurting the patient? Well, I think you have to ask yourself, if I take a lot of your money and I don't improve the quality or quantity of your life, have I hurt you? I just took away a nice movie or a good dinner out with your spouse. So to the degree that money is spent that doesn't improve outcome, yes, you could say they're hurting somebody. I don't want anybody to think my colleagues do this consciously, because they don't. In fact, most doctors complain bitterly about this system. However, they are financially entrapped into it and cannot get out. And many doctors coming out of training have no choice. The average physician is leaving medical school now with $250,000 in debt, and he can get that forgiven if he goes to work for a nonprofit entity such as a healthcare system for 10 years. So for 10 years, he can't leave this hospital if he gets dismissed by the hospital, his loan comes entirely back. So in the back of their mind is, maybe I don't do the best possible health care. Maybe I do mediocre health care. And what this turns out to be is profitable health care. I have no financial guns at my head, and neither do any of my direct primary care colleagues. So the only way I can make money is having people who say, I trust your advice. And that advice, if it's thorough, they will continue to pay for my services. If my advice is superficial, they will pay less or pay none. I am not financially influenced by anyone except the person on my exam table. And this is true of all direct care where the advice you're getting is paid for directly by the person consuming that advice. The problem we have with the present system is between the insurance company, the government, the state regulatory boards, the health network, and many times the employer. Every time that the doctor sits down in the room with his patient, there are 5 other opinions of what good health care should be that are in that doctor's mind in addition to the one of his patients. Those of us in direct primary care believe that only one of those people in that room should really matter, and that should be the only person we're paying attention to. Because we are not dependent upon serving the other definitions of good health care for our employment, we are employed only by the person on the table, so we are freed from all other influences that would change our opinion away from what that person's definition of optimal care would be. The present system, because it doesn't serve the desires of the person on the table, is actually inflating prices in an unbelievable fashion. So for instance, if you wanted to buy a laboratory test, say you wanted a complete blood cell count, and you go down to your local laboratory and you say, I'm going to buy that using my insurance card. So it will generate a $25 bill that will be billed to your insurance. If you have a deductible, that'll be paid to your deductible, and you'll pay that $25. If you were to take back your insurance card and tell that laboratory, I'm going to pay you cash, the laboratory is allowed to give you a 20% discount. So that complete blood cell count will be $20. But that very same laboratory with the very same technician will do that test if I pay for it for you for $2.50. And in fact, the markup on laboratories routinely runs between 10 times or 3 to 10 times the actual cost of doing the test. Same thing is true for x-rays. If you have any questions about direct primary care and the contrast with the traditional third-party payment systems, or you want to learn more about pure health functional family medicine, please feel free to reach out to me at our telephone number, 317-559-2515, or you can email me at drstock@purehealthmed.com or find me on my website at purehealthmed.com.